Hello, everyone, and thank you for joining us. We're talking today with CathyTodd, who is the Bariatric Program Coordinator with the University of Maryland Capital Region Health Medical Group's Bariatric Services Group. She's here today to talk about how do you prepare for weight loss surgery. Cathy, how are you doing today?
I'm doing wonderful.
What would you like to talk about?
So here, I'm so happy to have the opportunity. I will let you know I'm in a room by myself, so I feel comfortable taking my mask off so that you can hear me and understand me better, and we can feel closer up to one another even in this environment. So I want to thank you so much for taking your time on a Friday afternoon to hear about weight management and to find out information that's just not fruitful for you. It may be for someone who you know or someone who you know is struggling with weight loss and they are interested in weight loss surgery, not really sure what next steps do I take. So here we are to talk about what are the steps to weight loss surgery. I will share with you that not every person is a candidate for weight loss surgery, but every person is a candidate to learn more about how to take care of themselves, how to manage their weight, as well as how to access services through a healthcare system to attain weight loss in a new and more dynamic way. I share with you that your journey towards weight loss through a weight loss surgery center is different from those programs that you may have used in the past. Oftentimes, when patients come to our program, they have already have experienced weight loss, weight gain, weight loss, weight gain. I had a patient once tell me that she lost 100 pounds. She said she lost the same 5 pounds 20 times. So I tell you that we know that we need to do something to enhance our relationship with ourselves and enhance our health and well-being through weight loss. So in our program, we try to give you the information you need to aspire to a permanent, lifelong change in your diet habit and in your food relationship with food. Yeah, excuse me, in your relationship with food. So I'm going to share with you that the first step in our program is to call our office and to schedule an informational session. Now, what's an informational session? It's 1 hour of knowledge and information about what is bariatric surgery? What is the purpose of bariatric surgery? Who is a candidate for bariatric surgery? There are certain disease entities and medical treatments that are in place that we can't upset that in order to provide weight loss surgery. But in addition to weight loss surgery in our program, we also provide a dietitian who offers nutritional counseling that everyone will go through before they go to surgery. Many of my patients come onto our informational session, they're excited. They finally got up the nerve to call and find out about weight loss surgery. They've tried previous organized weight loss programs in the past. They've done competitions with family members. They've done competitions on the job. You know how the lunch crew on the job will say, by this date, whoever loses the most weight will win this pool of money. They've done that. They've done the cabbage soup diet. They've done the ice cream diet and all kinds of diets. And in the past, what they've experienced is a short-term weight loss with a rebounding due to a variety of reasons. So what we'll do is we help you to explore your relationship with food. At what times of day do you eat? Are you more hungry one time or another time? And when you make your food choices, what is it impacted by? So what I'm going to share with you is the very first step in any weight loss experience is to get in that mirror and tell yourself, I forgive me. I've only done those things that my body has called me to do. Because if you have the disease called obesity, that means that your brain requires more calories in order to attain the energy that somebody else will get from lesser calories. So you have been responding to a stimulus inside your body that is characteristic of obesity. So what is obesity? The disease called obesity is characterized by 3 things. One, when you go on a weight loss journey, let's say you decide for the next 2 weeks you're going to reduce your calories, you immediately have a reduction in energy. Second, it is difficult to keep your mind on things that your goals and you're focused on your activities of daily living in a lower calorie situation. As well, over time, it's intolerable to continue that pattern of lesser calories. And so your body is responding that it needs more calories in order for the energy that is required for your body to function normally. So what does weight loss surgery do in that regard? Well, what we teach you to do is understand, number one, how your body functions. Also understand that many obese people eat for reasons other than hunger. They get stimulated by the commercial on television. They can be stimulated by the smell of the Cinnabon in the mall and the like. And so many of our patients come to us with a habit of eating that they're not even aware of as well. They turned off the signal from their body when there's time to stop eating and when it's time to start eating. We try to engage that with you. So we make dynamic changes in your diet. We teach you about food. We teach you basic nutrition. We help you to understand how family history, how social dynamics, how just the life that we lead now, where we're trying to look for that 25th hour in the day, can get in the way of a planned diet. So we don't teach planned diets. We teach eating on purpose for a purpose. So we do pre-planned eating. We do pre-scheduled eating. And so food prep is a big part of your process, but not in a way that a lot of people think. That's something for you to find out when you call our office and find out what our dietitian has waiting for you. Some surprises and things that she has that is helping people to lose weight in normal ways. And the other thing is to prepare for surgery. So the next thing after you go to the informational session and learn about what our program is and learn how we eat and how our body uses the fuel that we put in our body, you make an appointment to come into our office. Now, our surgeon will see you, and of course, our services primarily are insurance-based. So we check your insurance, and we make sure that your insurance does have the benefit for this surgery, and so that you don't face the coming to their office, have an appointment, get your hopes up that you're going to have surgery only to find that insurance that you don't have the benefit for surgery. So in those cases, we have other programs and packages that we'll discuss with you individually to see if there's a way to hedge that. In addition to that, we make sure that on your first visit is here in our new offices at the National Harbor, and our appointment is about an hour to an hour and a half long. We do pay for your parking as long as you park in the parking garage that we have assigned for our office, and we'll give you a lot of information about that. Also, we ask you to embrace a new relationship with food. This is lifelong. And so the goal is for us to help you to write your lifelong success story with managing your weight so that you don't feel like it's impossible. You don't feel like a failure, or that the experience that you've had in relation to trying to be more healthy will be your relationship in the future. So we're painting a different picture of your tomorrow so it doesn't have to look like your yesterday. We provide you with support and support group meetings, as well as one-on-one consultation. We also provide a dietitian who is for our program for bariatric patients to help you through and assist you with weight loss. As well, we have a team that's educated in sensitivity to obesity and to the needs of obese people, and just to who we are to be kind to one another and sensitive to the journey that you're on. We understand that your weight is your success work happening. So we have to provide an environment where the work that you're doing is appreciated, supported, and encouraged. As well, we encourage your family to take this journey with you. So if you have a spouse who can join you on your appointments, or a significant other, or a best buddy that you would like to take this journey with you, and lots of our patients have their adult children come in here and they take this journey with them as well. And so the intent is for the whole family to improve on their dietary habit. Our goal is to see all Prince Georgians improving on their quality of life through taking a look at how they can modify their dietary habit, modify their exercise routine, and embrace those changes that they can sustain day after day, maintaining those changes over time. And then we will be as successful as we've chosen to be. Now, in our program, we do have patients that come as far as Delaware. We've had patients that come from West Africa. We've had patients to come from Ohio and Georgia to come and talk to and find out about weight loss surgery and actually have surgery in our program. We focus on our near neighbors. We want to see where people are more interested in their weight loss experience before they start to have some of the complications that are often associated with obesity, like diabetes and hypertension and high cholesterol. I will say, having been a bariatric coordinator for 12 years, I am so pleased to see that patients are coming to improve on their health and well-being before they have major complications like amputated limbs, like strokes, like heart attacks, and they are anticipating wellness at a level that is absolutely inspiring. So I encourage you to join our team, join our group of patients who are on their journey, and understand that we are your lifelong partner. So Dr. Rickford likes to say, when you have surgery with our program, you are a patient in our program from now on. And he will work along with your primary care and your other healthcare team members to improve on your health and well-being. And we know that we eat according to circumstance, and we teach you how to eat according to your life's desire, as opposed to eat the food that you desire all the time. There is no never food, and there is no all the time food. It varies with you. We are dynamic human beings. So who we are at 200 pounds, who we are at 130 pounds are two different people. And so the journey from 200 pounds to 130, the journey from 350 pounds to 200 pounds is a up and down journey. Weight loss, healthy weight loss, plateaus and drops, plateaus and drops. And you've got to have the wherewithal to be patient as your weight loss occurs. You know, I like to tell people we are more patient with our adult children to get it together than we are patient with our own bodies to catch up with the behavioral changes that we do. So we encourage our patients to understand that when you make a change in your diet, in your relationship with food, it'll manifest a month later. And so you have to be patient with the process while your body catches up to your behavioral change. So you embrace a new food relationship, you go to the dietitian who listens to you and your concerns, and as your body changes towards what you'll need to do before and after surgery, your weight loss success is according to your work, and it is with your bariatric coordinator, that would be me, who will help to examine your internal motivation, because motivation from within is lasting. External motivation, losing weight for someone else or because somebody else told you to, is not as long lasting as if inside of you, you're motivated to say, you know, this is my journey, it's my time. And that's what my patients say to me. When they're ready, they say, it's my time to get first in my life to where I'm taking good care of myself so I can be the best and give my loved ones my absolute best. I can do the next slide. So what is the bariatric surgical process? So after you come and see Dr. Rickford in the office, he will send you to see various physicians in order to secure that you are safe going forward to surgery. Our primary focus is for you to be safe. So we send you to the cardiologist, a heart doctor, to take a look at your heart and make sure that your heart is stable and healthy enough to withstand anesthesia. We want to get a sleep study because it is studied and researched that those who don't sleep well do not eat well. So if you're a person who tosses and turning half the night and you find yourself sitting up on the side of the bed in the middle of the night, or you report poor food quality, then what happens is we send you for a sleep study. Oftentimes people will eat higher calorie foods and fast burning foods like candy and cookies and chips. Not that they're bad things, but on a daily basis, and their intent is to give themselves energy to make it through the remainder of the day. And it's because they didn't refuel with their sleep the night before. So we have to take care of that. And there are interventions that the pulmonologist will work with you to treat and to manage sleep issues if there are some. The other specialist that we send you to is a gastroenterologist who's going to look down in your stomach and make sure that your stomach is healthy prior to Dr. Rickford doing your surgery. We don't want any surprises in the operating room, again, to keep you safe throughout your surgery. All these are available at our University of Maryland Capital Region Health providers. We have them located here at the National Harbor. There's some providers down near Cheverly. There's some providers up near the Bowie office. So we try to accommodate you in as much as we can. As well, we understand that people have individual differences. People come here with back pain. They come here with leg pain, knee pain, and they're on pain medication. They are also having other challenges. Some have seizures, some have asthma, some have complications of having to be on oxygen all the time. Some have chronic diseases like rheumatoid arthritis, and some have lupus and myasthenia gravis or sarcoidosis. And we will work with you from a medical perspective to work around those care modalities with your primary care doctor and the specialist that you see to manage those things and keep them at bay while you're in the process of losing weight. We have so many patients who come to us. A complication of obesity that a lot of people are not familiar with is because they're experiencing infertility associated with being overweight. And it is a wonderful thing to see someone 3 to 4 years after surgery finally get pregnant and have their baby, and the joy that's in their eyes of their newborn baby. And so that is an aspect of obesity that a lot of people don't understand, but it's in a hormonal system. So therefore, it's important that I tell you something. We advise our patients not to get pregnant within 2 years after surgery because of making sure that your body has healed on the inside and that your body is receiving the nutrients that it needs so that you'll have the nutrients available to feed your unborn child. So that is another aspect of the care that is provided here in the Bariatric Care Center from the standpoint of getting people healthy enough to become parents. Also, taking care of the family is a priority. So we provide in our post-op program, we have support groups. We have support groups for men, we have support groups for women, we have support groups for people who are 5 years out from surgery, we have support groups for people who are 10 years out from surgery. And what happens is, though we've only been here for 2 years, we have patients who come here who've had weight loss surgery in previous settings. They move to this area and they need the support. They know they need lifelong support in order to be successful. The research has shown that people are 60% more successful with maintaining their weight loss if they continue to participate in support group meetings, keep their follow-up appointments with their surgeon and their follow-up appointments with their dietitian. As well, we send our patients back to see a psychiatrist within 6 to 12 months after surgery, because as our body habitus changes, expectations of our loved ones change, dynamics change in communication. And so we want to make sure that you're optimally prepared for the changes that you can anticipate after this surgery. I thank you for this opportunity. If you have any questions and you have any comments that you'd like to make, I'm happy to receive them. I do want to share with you this note. A patient came into our office. She said that she had so many ideas about having this surgery and she hadn't acted on it in the past. She came into our office to see the primary care doctor whose office is down the hall. And when she saw that we had a bariatric care office right here, she walked down the hall and she could barely walk down the hall. And I had to give her a chair halfway down the hall. And she said, "This is why I need you." And she shared with us that she had not acted on her desire for bariatric surgery because she feared that people would judge her. Please note, in this office, we accept you as you are. We accept you on your journey. We understand that something brought you here, but our goal is to be future focused. Our goal is to look at your tomorrows. Our goal is to help you to engage control over the food so that the food doesn't control you. Our goal is to help you to learn that there's something in between hungry and full. We teach you to eat to about 4 on a scale, from 1 being hungry and 10 being full, to about 4 on that scale, so that you learn that there's something in between being hungry and being full, and that there's opportunities in your life and in your daily activities where you won't have food going on in your stomach, but you'll be healthy with it, and that you will understand that you don't set yourself up to be extremely hungry, because many of our patients have the habit of skipping meals. And by the time they do eat, they make food choices for fast burning calories because their body's saying, "I'm really, really hungry." So we teach you how to anticipate what your body needs. And we help you to understand it is food that got us to be obese, and it is food that is the medicine that will help us to get well. We have to learn how to be in control of that food And we also need to learn how to receive the joy of just the experience of starting on this journey towards weight loss. So we're not interested only in looking at down the road 100 pounds from now at success and joy. We're looking at joy today and understanding that we've learned something new, we've embraced something new, and we have made an attitude adjustment to something new that will be a carry on in our behavior so that we experience joy today. So our health assessments and a recap are cardiology, your sleep study, your GI doctor, as well as any other physicians that Dr. Rifford refers you to. All these services are provided through University of Maryland Capital Region providers. And I will share with you, we're right down the hall from primary care doctor, from a cardiologist, from a pulmonologist, and various other providers, and including an ENT doctor. So we are huddled here together in order to provide a scope of services for our patients as they may need. I will ask you to go to the next slide. So the bariatric process, the final step is in our program, halfway through your process between when you see Dr. Rifford and when you go to surgery, we will sit down with you and help you to understand that this is a lifelong change in your behavior with food. And that will be demonstrated, one, in some pre-surgical weight loss. It will be demonstrated, two, in compliance with what we require that you do in order to obtain your clearances, in order to have surgery. Also, in you explaining what you're experiencing in your life that may be getting in the way for you, so we can help you and counsel you and refer you to the right resources so that you're willing to be open and clear about what your journey is and those things that may be getting in the way for you. So once you have come to know you, understand this is a lifelong journey, you will be prepared to have bariatric surgery. This is a process that may take 6 to 12 months before you go to surgery. You are on a lifelong journey. So 6 to 12 months is the mere beginning of your process towards weight loss that will begin on your first appointment in our office. We want your success with weight loss to begin the day you come in our office, and that you're not delayed in your joy for 6 months to a year, so that you don't put your hope in the surgery, and that you understand that the success in weight management is yours. The surgery that you choose with your surgeon is a tool that you will use to attain your weight loss. So please know that once you've had your surgery with our program, you are a patient for life. We will continue to help you address your challenges. We'll help you to embark on a new sense of what is a sense of wellness for you, and we will help you to develop your long-term success purpose and plan. And we thank you so much for inviting us on this journey. Are there any questions?
So Kathy, tell me a little bit about what happens after I've lost all this weight and I've got all this skin hanging on. Do I have to tape that up for the rest of my life? I mean, do I have other options to get rid of that? How far along the process does the surgical process go?
So I thank you for your question. It's a good question, and oftentimes our patients do ask that. So there is a plastics and reconstructive surgeon in our program, Dr. Vakisha Fripp. We will provide her consultation after you have achieved your weight loss goal and maintained it for 6 months. So typically the excess skin, primarily on the abdomen and the arms and the legs that people get concerned about, we will ask you to exercise, to take your vitamins. So those things help to pull the skin back. But it is clear that people do have excess skin, and they're concerned about that because the folds of the skin can cause medical problems with infection in the skin. And so that is evaluated by our plastics and reconstructive surgeon, who will see patients once they have lost their significant weight and maintained it for 6 months. It would be unfortunate to go to her and have her to tighten that skin in surgery, and then to continue to lose weight and have a similar complication after. So we ask you to be evaluated no sooner than 1.5 years to 2 years after your bariatric surgery. so that you can have that excess skin removed. When you do go see her, the first visit that you have with her, she will evaluate the skin that's there, and she will differentiate for you between what is cosmetic and what is medically necessary as an intervention for your skin removal. Some of those services are reimbursable through insurance, and the cosmetic ones typically are not reimbursable through insurance. And she will talk to you and clarify that for you. We do ask you to be healthy, though, proactive on the front end, and that is by wearing the appropriate garments while you're exercising after surgery. And as your body you're losing weight, losing fat cells, we also ask you to take the appropriate vitamins, and the dietitian in our program will guide you through the multivitamins, the calcium plus D, the vitamin B complex vitamins that you're prescribed in your postoperative period.
Which brings me to another question. I'm assuming that once I have this surgery, I can't go back to eating the way I did. I mean, am I able to sit down and have an 18-ounce steak and not have to put the weight on? I mean, what's the protocol for managing diet after surgery?
That's a good question as well. Thank you, Bobby. What we require and what we teach before you have surgery is how you will eat after surgery. So we put you on a diet plan that is curtailed to you. We talk to you about whether you work at night or you work in the daytime, whether you eat with your family, whether you eat alone, if you multitask your meals in front of the computer, as oftentimes we do. We will start you on protein supplements that will help to replace meals before surgery as well. Everyone will be on a liquid diet for 2 weeks before surgery to help to reduce the calories in your diet before you go to surgery. As well, our dietitian will teach you how to eat small meals and to drink water in between and to have healthy snacks as needed. So, because we do not want to set you up to be too hungry. If you're accustomed to eating an 18-ounce steak for dinner, we will not tell you you can't have an a steak. You just can't have an 18-ounce steak. You may cut it down to a 9-ounce steak, but the dietitian will build those calories into your day's activities, and she will have you have other calories throughout the day be reassigned to accommodate for those special meals, like at anniversaries, like at birthday parties, like at the holidays, when oftentimes the food is the focus of the social event. It doesn't mean that you can't be a part of it. You're just going to need a smaller serving size. Most of our patients after surgery can't eat a 9-ounce steak, can't eat an 18-ounce steak. Most of our patients can eat a 3-ounce piece of steak or maybe a medallion of steak, but the medallion that they eat tastes just as good as the whole 18-ounce steak. They just eat a smaller serving of the steak. As well, we want to eat to our comfort. So we never eat till we're full. We eat to our comfort. And so the food doesn't dictate how good it tastes or what the experience of it's going to be. The serving size doesn't dictate the food, how good the food's going to taste. We do understand that when you're accustomed to certain foods that you bring up and it makes your mouth water because you have a memory of a food, we don't want to take away the joy of eating. What we want to do is bring down the importance that we put on a meal, the focus that we put on a meal, and the serving size that we put into a meal.
Mm-hmm. And my understanding as well is that there is a need to lose weight before the surgery, and that does a couple of things. One, it and correct me if I'm wrong, it begins to change the lifestyle habits, but also makes it easier on the surgeon to get to the areas he has to operate on in terms of, making the liver smaller. How much weight typically do you ask patients to try to lose before surgery?
So Dr. Rickford will sit down and talk with you, and it depends on your body habitus. On average, patients lose somewhere between 15 and 20 pounds in a 6-month period. And we help you to gradually lose the 1 to 2 pounds a week in order to attain that goal. The other thing that happens, and I appreciate you bringing that up, is that God made our body. So the liver is the first place that our body loses fat when we drastically drop down our calories. So we want to shrink the size of the liver because our surgeon does this surgery in a way that's called laparoscopically, meaning you don't get a big incision on your stomach. You have very small openings on your stomach, and he uses utensils through those openings to do the surgery. Just to lift up the liver out of the way in order to attain the top of the stomach. But if the liver has shrunk down and moved back into the size that it's supposed to, so if you were to put your right hand over the top right up part of your abdomen or the whole stomach area, but the right hand side under the left breast, you set your hand there. That's where your liver is supposed to sit. For most of us, the liver has expanded across that part of the stomach. That's the upper part of the stomach. And makes it difficult for your surgeon to do the surgery in a safe way. And so when you go on a diet, your liver is needed to filter all of your blood. So the liver will shrink down and be more efficient as you lose weight. And so we require that you excessively drop down your calories in those last 2 weeks before surgery so that you can accomplish that shrunken liver and safely be able to do this surgery. Yes. Powerful question.
Great. Thank you very much, Kathy. No, we're actually at 6 o'clock, so I'm going to thank you very much for all your time and for sharing all your wisdom with us. People who are interested, if you click on that QR code, it will take you directly to the bariatrics pages of our Capital Region Health website, and we look forward to seeing you at a future information session about bariatric surgery. Thank you all very much. Have a great day.
It's been my absolute pleasure. Thank you.